Okay, so today we are going to do a heart and neck vessel assessment, and I will do a room scan. Here's the wall. Okay, and this is where I put my computer. Here, okay. Okay, so my patient is Mr. Montagna. Mr. Montagna, I will ask you a few questions. Do you have any cardiac diseases in the past?
No,
Okay, and did you experience any chest tightness or chest pains in the last 2 weeks?
no,
Okay, thank you. So I will inspect the um, any presence of JVD. So I will have to make you lie down in a supine position with head of bed elevated at 30 to 45 degrees elevation. Okay. So please look up, put your face on that side. Yeah, look that side. So checking for seeing a triangle here and checking for any distension or bulging, and it's flat. So I'm going on the other side to check for JVD. Can you put your head on the other side? Okay. Okay, thank you. And that's it. Thank you. Can you please sit down? That's it. And so now we are done checking for JVT, and there's no JVD, no presence of JVD. I will now palpate the carotid pulse. Okay. So it's smooth and strong. And using the bell of my stethoscope, I will check for any presence of bruise and presence or swishing sound. So I will instruct my patient to inhale and exhale, and then hold after you exhale. Okay. So inhale, exhale, and hold. Thank you. So I did not hear any presence of bruise or swishing sounds. And now the precordium area, I will check for his anterior chest for pulsations or any movement, and just can see normal respiratory movement. And then I will also listen for the apical pulse rate. Here, I will just palpate it. And here, it's on the mid clavicular line on the fifth intercostal space. Yeah. So the PMI, or the point of maximal impulse, is not displaced. Is at the fifth intercostal space, mid-clavicular line. Thank you. So using the diaphragm of my stethoscope, I will listen to his four valves. Okay. So starting from the aortic valve at the right of his sternum on the second intercostal space, I'm listening for the rate and rhythm, identifying the S1 and S2 or the lub-dub, and listening for extra heart sounds and murmurs. Okay, lub-dub, lub-dub. And this is the pulmonic valve, which is on the right, on the left of his sternum on the second intercostal space. And now going to his tricuspid valve on the next to over the next to the sternum or the sternal border at the fifth clavicular line, and going to the mitral valve here, mid clavicular line at the fifth intercostal space. And now I will use the bell of my stethoscope auscultating the 4 valves of his heart. So again, going to the aortic valve, listening for the rate and rhythm, identifying the S1 and S2, listening for extra murmurs and heart sounds. And the same thing with the pulmonic valve area, listening for S1 and S2, and rate and rhythm, and checking if there are any murmurs and extra heart sounds. Going to the tricuspid valve, and going to the mitral valve. Okay, so the rate and rhythm, it was regular. The rate, I should say between 80 to 100 beats per minute. It was regular, and then I did not hear any extra heart sounds or murmurs, and then I definitely identify the S1 and S2 or the lub dub. And that ends the heart and neck vessel assessment. Thank you.